Revolutionary talk for revolutionary times. Promoting peace, liberty, and prosperity around the clock. LibertyTalk.fm.
Welcome to Living in the Solution with Dr. Elena George. Today we have a special show, one I'm looking very much forward to. We're going to speak to somebody who can speak about our healthcare system in a slightly different manner. I know that everybody watches TV and listens to the radio, and there's a wealth of pharmacy commercials or pharmaceutical commercials on TV. To me, it seems like there's been an explosion. And today I wanted to have somebody who could speak to both sides, a pharmacist and somebody who's more tuned to the functional side of healthcare, which I think is the future. So we're going to speak with Miss Marina Buksov. She's a functional pharmacist, mental fitness and health coach, herbal educator, and lifelong learner of the healing arts. She's the creator of Build Your Holistic Herbal Practice. It's a course mentoring other healthcare professionals in clinical herbal as well as business skills. She guides practitioners to rediscover their passion for medicine by expanding their mind and clinical skills to include natural, holistic, alternative, and herbal medicine from which conventional medical practices originated. She believes in honoring plants as food and medicine for sustainable and sovereign health. She's a functional pharmacist as part of the PharmToTable telehealth platform and the host of the Holistic Pharmacy podcast. She uses her multidisciplinary background to educate patients about the least invasive and most natural methods for healing the spirit, body, and mind. Her truly holistic approach helps women embody the best versions of themselves and lovingly celebrate the skin they're in. When she's not studying, Marina likes to dance, paint, and tinker with various concoctions, and she lives with her husband and 2 children in New York City. So, Ms. Buksov, I want to thank you so much for joining me today because I think what you do is the future of healthcare. And I wanted to start off by asking you how you made the transition from being a pharmacist to being a functional pharmacist.
Thank you so much for that introduction, Dr. Elena. Well, I grew up quite conventionally, I would say. My background actually is that I'm an immigrant. So I came here from Ukraine when I was 9 years old, moved to New York. I'm still in New York today. And I guess I had a knack for the sciences, and my parents themselves are biologists and chemists. So I sort of naturally, started to study math and physics and chemistry. And my dad actually, proposed that I look into pharmacy as a profession. So I did just that. And I decided I will just try it. And if I don't like it, I could always change my major. But I ended up, sticking it out and loving it. And only after graduation or like leading up to graduation, I really started questioning the methods that we were being taught, because as fun as it was to learn the mechanism of action of these medications and these pharmaceuticals, I found myself not being truly aligned to go one way or the other as far as the opportunities in pharmacy. So like hospitals or residency programs or pharmaceutical fellowships, like all of that sounded really good and admirable on paper, but I found myself not truly wanting to go into any of these areas. And so I that's when I started really questioning whether this is, the best field for me. And even though, as I said, I loved education and I learned a lot, I realized that it wasn't really focusing on the big pictures as far as like public health and preventative and wellness approaches and lifestyle. And also I had a personal health journey at this time as well. So I sought, all the conventional modalities. I did everything that the doctors were telling me to do. I even ended up doing procedures and surgeries and taking pharmaceuticals, and none of these things actually helped me definitively with my diagnoses. So that was another aspect that, I realized there was more than just pharmaceuticals and the pharmacological approach. And I realized that even though we were taught as pharmacists to value the non-pharmaceutical and the sort of lifestyle management modalities, we weren't really taught too much about that. And, our focus was on the drugs. So I found that there was that gap, in my knowledge. And so I opened myself up to seek out better, or at least other alternatives and options for my own health. And at the same time, I started seeking out what I could supplement my pharmaceutical knowledge with. And I started seeking out all these programs and courses and certifications online. And that's how I sort of transitioned into first health coaching. And then I found functional nutrition. After that, I was introduced to herbalism. And then I ended up completing an herbal program. And from there, I sort of found this new emerging field, which is functional medicine, and functional pharmacy is even newer. A lot of pharmacists, I think, are just not seen, and they actually currently don't have the legal scope as a provider. They don't have that status. So it's sort of like this newer field that's emerging because we're wanting to get more involved into preventative care and into actual medical care, and not just be the drug dispensers that just get paid per prescription.
Well, that's quite a journey, and I can completely understand where you came from. I think, and I said this on the show before, most practitioners who start off in your standard medical course or stream, whether they're pharmacists, doctors, nurses, it's usually something personal that happens to them. And then they realize there's a bigger world out there. And, that transition, because our society, I don't know what your take on it is, but there always seems to be, if there's a pill, take it. And if you can take it for the rest of your life, then that's a good thing. Forget about everything else about putting skin in the game, fixing the problem. It just seems to be this mantra of there has to be a medicine that can be prescribed to fix it. You were in the stream of that. So my question is, did you get any pushback from your colleagues, from the people you trained with when you started to look at it in a bigger way, in a bigger picture? What did they think about that? I know you didn't care because you kept going in the same direction, but I'm just curious, were you in some way did they try to dissuade you from it?
Yeah, yeah. Thank you so much for bringing that up. The thing is, when I was going to school, I didn't have as much information. I just sort of put my head down and I did what everybody else did, and just focused on the material and on the tests and really on getting to my goal. And as I shared, only after I was like at that finish line did I finally look up and start to see some things that, didn't make sense to me. And I think during school too, like close to graduation, I had some opportunities to get involved in projects and in clubs. And in fact, in my school, there was a alternative medicine club for pharmacists. And there was also a project I worked on to sort of advocate for it with my group as part of one of my classes. And then I also had the opportunity to take a complementary medicine elective as part of school as well. So I think all those things were really positive because they helped me shape my interests, and they gave me that permission that, okay, this is allowed in the conversation. Even as a pharmacist, I'm allowed to have these interests and pursue them. So I think that was really empowering for me. And then I kept in touch with my mentor who taught that elective class, and she actually connected me to some of the people that also became mentors of mine. So all that to say that there's going to be like-minded individuals on both sides of the fence if you look for them. And it's really important to, I think, find those people that you do resonate with and that you can ally yourself with. And on the other side, yes, I do have a lot of pushback nowadays too. I think if you just go online, it's just very easy to see that no matter what people are saying, there's lashback at them. There's so many internet trolls and all kinds of things going on, and there's different levels of them because maybe they wouldn't say it to your face, but they feel perfectly okay sharing those kind of things online. And so I think that's just kind of one of the things in our world. We just live in this perpetual state of duality where you have to pick a side, and so I've chosen my side, and I'm not like fixated on it. I am sort of at the point where I can see the risk and benefit. And so I am aligning myself just utilizing the information that I have at any given time. And so at this point, I feel like it's important to explore both sides and then, look at those risks and benefits for both and not just focus on one lane and just completely disregard the other.
No, I applaud that because I think that's really where we need to be in the healthcare space. I mean, I personally think the way the direction of our society in terms of our health dispensing is going, it's less about picking the side of the patient and the side of the doctor-patient relationship. It's more about following these commands from top down, which really they seem to completely be disconnected with fixing the healthcare problem. Forget about cost for a second. That's a whole nother conversation. But in my course of having my practice open for 20 plus years, I'm seeing people coming in sicker and on more medications. And it seems to me that they're taking medicines for the side effects of other medicines. And when you take your power back and you take that energy that you just described, where you don't really, it's not about what other people think, what people say, or their dog in this particular hunt. It's about what you know to be is right. And also being fluid, right? So it's not like there's only one way to fix everybody, one size fits all. It seems this functional pharmacy, this pathway is about thinking outside the box, right? You might have the same disease, but it may not be the same reason that you have the disease. So therefore other aspects come into it, it's not very just concrete. Is that a good way to think about it?
Yes. And, the concept of staying fluid and staying open is what's really important. And I think that's what really causes a lot of friction and divides a lot of people is this illusion that, there are more differences than there are similarities. And so when we have that mutual goal of we want to see people get better, we want to provide them solutions, right? We want to maybe keep costs down. Maybe we're focused on that factor as well. Then it gives us that, again, permission to look outside that proverbial box and to play around with it and not just throw the baby out with the bathwater, right? So instead of just dismissing some theory or saying there is not enough information, actually going and digging deeper and looking at the literature and then looking at the other types of evidence like historical use and traditional use. And I think all of those are different types of evidence because we are practicing evidence-based medicine, but we're not necessarily looking at all the evidence that's available and we're not classifying the levels of evidence. We do have some online as far as like concepts of what type of evidence is better, or more trustworthy or has a bigger reputation, but we're certainly dismissing some things outright, I think. And so I think when we also look at the expectations, like you said, the pill has become the expectation, right? We've sort of evolved our medicine to be so simple that, you just go in, you get a diagnosis, and then you get a prescription, most likely for a pill or a drug or some surgery or procedure. And then that expectation is that you either get fixed, quote unquote, right away, and it's like a passive process, or you might have to be on that whatever procedure or pill for the rest of your life, right, in order for the problem to remain fixed. And so I think, there is a two-way street here where we have to really evaluate, what is the expectation from the patient and from the provider's point of view, because we sort of like as a society have maybe unconsciously entered into this type of agreement and expectation, then this is the way that our healthcare looks. And I certainly don't think this is the only way. And I certainly don't think that this is the quote unquote easy way either, because it does come with a lot of drawbacks. When we try to take the easy way out, we do end up losing some things, including our choices and our power.
I couldn't have said it better. On that note, let's take our first break and come back. You're living in the solution. Welcome back to Living in the Solution. We're speaking with Ms.